Hello everyone, and welcome to my presentation on behalf of collaboration with the Strategy Unit at NHS Midlands and Lancashire Commissioning Support Unit, entitled We've Been Framed, Reflections on the Use of Frameworks in Realist Synthesis. My name's Andrew Booth, and I'm presenting on behalf of the University of Sheffield. So the thought behind this presentation is that over the last few years we've seen the growth of two particular areas of synthesis. Framework synthesis, which has become a popular form of synthesis of qualitative research, and particularly seen as a way of engaging with theory in the form of frameworks or conceptual models. And frameworks have been proposed as a way to juxtapose quantitative and qualitative data within systematic reviews. On the other hand, a topic that needs little introduction with this audience, realist synthesis, which has demonstrated its usefulness in being able to explore mechanisms in complex interventions. And of course it has its own framework, such as CMO configurations, if then leading to constructions and logic models. So the question is posed, why not a merger of these two methods together? This presentation is going to look briefly at framework approaches to synthesis and then broadly outline how frameworks have been used in realist synthesis to date, and then share some experiences from our NIHR funded project for the Health Services and Delivery research programme on new models of care. And then it's going to conclude by looking at the potential of bringing realist and framework synthesis approaches closer together. So where to start? Well, those of you who are not familiar with framework synthesis will find both of these articles good introductions. Ginny Brunton's work as part of her PhD thesis on innovations in framework synthesis, which covers the applications and history of development, and our own work on how to use a specific variant of framework synthesis, best fit framework synthesis, to study improvement in healthcare. So the history for framework synthesis is that framework analysis, the primary version of it, was developed by Ritchie and Spencer in 1994, and they constructed thematic categories into which data could be coded and outlined the 5 steps: familiarization, framework identification, indexing, charting, mapping and interpretation. And subsequently 2 review teams, Oliver and colleagues at the Epicenter in London and ourselves in Sheffield, developed methods of synthesis, first of all to code themes a priori, particularly as a result of themes generated through stakeholder consultation, and in our own case identifying a framework systematically from the literature. And the terminology of best fit framework synthesis captures the fact that what we were looking for was a good enough framework that explains more than 50% of the data, with the rest of the data being handled inductively. So we commented that framework analysis or framework synthesis is best suited to research with specific questions, a limited time frame, and issues that have been identified a priori. And these are many characteristics shared with realist synthesis. And framework synthesis approaches allow a team to go beyond the insights from isolated case studies to look for patterns and themes from the synthesis, and therefore come up with an action plan that can address system-wide considerations. And again, you'll see similarities with the way that realist synthesis seeks mechanisms that move from the specific case to the more generalizable. Best fit framework synthesis, despite its recent origins, has been cited over 600 times in 3 methodological articles. And again, it enables the review team to move from the specifics of the case to a wider conceptual framework. And this framework can be drawn either from behavioral models or other forms of theoretical or conceptual thinking, or more pragmatically and instrumentally from policy frameworks. The example given here being an NHS modernisation agency framework on protocol-based care. And so framework synthesis fulfills the requirements of theory testing and theory generation. And the particular contribution that it makes is in making a clear distinction between the original theory or model and the enhanced version that seeks to go beyond the individual studies. Best Fit Framework Synthesis was specifically designed for use within systematic reviews because of its characteristics of auditability and transparency, particularly in forming a division between the original model and then the subsequent population of a revised model that makes it very clear what the original contribution is. And it requires systematic identification of theories and frameworks, for which we devised an elementary strategy that involves a combination of model, framework, concept and theory in conjunction with an intervention or a particular condition. And we wrote this up in Health Information Libraries Journal over 5 years ago. Just a quick example of this within the area of qualitative synthesis. Here we have a document that looks at barriers and enablers to guideline implementation within an obstetric context in low and middle income countries. And the authors anticipated thin data, which is often the case with realist accounts that have been described as bricolage, piecing together sometimes thin interpretations to make a more interpretive synthesis. And secondly, they pointed to the suitability of existing frameworks for categorizing barriers and enablers. And so initially they focused on the SURE framework, but they actually found that this framework was a poor fit to the themes that were presented in the included primary studies. And so this is one of the potential limitations of framework synthesis and requires a little bit of scoping to ensure suitability. And this can include such things as making sure that the model is temporarily suited for the production of the synthesis. And they then decided to adopt a model that was more suited to their particular topic as an a priori framework. And this organizational stages of change model was developed from a related but not identical area of practice in South Africa. And on the basis of this, they constructed a data extraction template that used this model as a framework for coding of the data. And this enabled them to plot the barriers and enablers and to create a new framework, and then to move further beyond this to create a hypothetical model. And they concluded that the strength of framework synthesis in their review was as a rigorous and systematic methodology that enabled them to piece together data from thin studies, and that supported their choice of methodology. And they were able to identify a conceptual framework that fitted their data, and were able to populate this by searching and appraising the relevant qualitative evidence. So hopefully from this case you can see the potential for use and potential similarities too for realist synthesis. Now, if we think of the 6 components of the realist search which feature elsewhere in the conference program, we can see that frameworks can make a potential contribution at several points. Potentially they can offer a sampling frame when trying to populate the program theories. as already mentioned, they can provide a framework for data extraction, but importantly too, they can provide an interpretive lens so that they can be used to provide an interpretation in understanding the program theories. And if we look at existing guidance on realist synthesis, we can see the appearance of frameworks. So, for example, in this examination of the program theory of public health legislation, we can see the use of a framework. But rather than systematically seeking a framework in the way that framework synthesis does it, the realist framework was developed from a number of sources and essentially constructed by the review team. Another example of a framework from the review by Rycroft Malone, used as an exemplar for implementation science, where they pieced together an outcome-focused theoretical framework, and then they tailored specific questions within 4 component domains, as illustrated on this slide. And then if we look at Ramsey's, there's the key consideration of comparing findings with the existing literature, and it acknowledges that an evidence-based framework can be used not only as a way of explaining some of the findings, but also in spotting some of the gaps or areas that are partially or incompletely covered. So moving to our project was funded by the Health Service and Delivery Research Programme of the National Institute for Health Research. It was looking at new care models that were seeking to integrate care within a primary care context. This project ran over an 18-month period. So for our realist review, we identified 6 candidate frameworks that offered a frame for looking at the review data. And we used one of these suggested approaches for framework synthesis, which is the use of a meta framework that brings together and harnesses the strengths of multiple frameworks. And we use that through the 3 stages identified by David Goff and colleagues: generating, exploring, and testing theories. And for our own debrief and experience, the team members use memoing to look at the contribution of each framework. These are the 6 frameworks. You'll see that several of these are from a policy context. Others of these have been proposed by development agencies, such as the King's Fund Centre, and one of these is the Quadruple Aim Framework, which seeks to bring together patient experience, population health, healthcare costs, and staff experience. And here's a sample of a table that collates the experience of the group in using this particular framework, showing some of the advantages, the nature of the framework, and also some of the reservations in using this particular framework. And this level of critique or analysis is important when using framework synthesis. And so what did we find? Well, each of the 6 frameworks did offer a unique contribution, and these contributions could be quite different, all of which are relevant to realist synthesis. They could be instrumental in helping the review process, so offering a scaffold for data extraction. They could be conceptual in helping the team to think and interpret the findings, so operating as a window. Or they could be political, as a way of cascading the findings in a way that's already familiar and recognizable to stakeholders and policy, and so operating as a lens. On a reflection, using 6 frameworks was a bit heavy-handed, if you like, but did allow us to confirm that selecting a best available fit rather than trying to be more comprehensive was a sensible way forward. And it offered a unique opportunity to look at the merits and strengths and weaknesses of the different frameworks. What did we conclude? Well, we concluded that framework synthesis is not simply a synthesis method in its own right, but it offers a set of procedures that we can use specifically within a realist review once we get beyond the generation of program theory to examine the empirical data in a systematic way and to map the findings from that data. But we also discovered that the synthesis effort must remain proportionate to its added value, so we mustn't be too heavy-handed in our choice and use of framework. So what am I proposing on behalf of our team? Well, that realist synthesis and framework synthesis are complementary approaches. The frameworks of realist synthesis that we're familiar with could be used to generate the program theories, and then other frameworks can be used for contextualizing the background literature, planning the sampling strategy for the empirical search, conducting the data extraction, and making a bridge between program theory and mid-range theory. And finally, as an acceptable and perhaps already pre-digested form of sharing findings, we can attach data from our review to policy frameworks that are already familiar to our end users. And then there's the role of logic models that figured strongly within our particular project. These are an attempt to provide an incarnation of program theory, but they also offer a structure by which the data can be extracted and the findings can be interpreted. These logic models offer a potential scaffold by which we can analyze the elements of a logic model, and the mechanisms are that first of all we deconstitute the logic model into its individual components, and then we reconstitute it into a revised, expanded and tested logic model that's populated to include data from the program theory. So, in conclusion, I would argue that now is the time for a rapprochement of the idealist and realist methodologies for exploring and explaining complex interventions, because, as we've demonstrated, they're much closer than we may think. Thank you for your attention. Here are some of the methodological sources, and I'm very happy to answer your questions.